Hi everyone, welcome to GoLocal Live. I'm GoLocal News Editor Kate Nagel. Thanks for joining us this Wednesday afternoon. We have the latest in health with Dr. Dale Bond from the Alpert Medical School at Brown University. Doctor, thank you for joining us today.
Thank you for having me.
I appreciate your coming in, Professor of Psychiatry and Human Behavior. Here we are, it's February. A lot of folks might not have stuck to their New Year's resolutions. A lot of your focus and research is what motivates, what keeps people on a regular workout schedule. Again, from that psychological human behavior standpoint. But before we even go into that, I just want to talk about how you came to the Alpert Medical School.
Yeah. My path, I think some would consider atypical. I was a faculty member at another institution, which was primarily teaching focused, and I wanted to do more research.
Okay.
And so I wanted to gain more experience in doing clinical trials and writing grants, and we have some of the best grant writers and clinical trialists in the world at Brown, and so I came here to do a postdoctoral fellowship. So I kind of went backwards, and now I've been a faculty member almost 11 years now here at Brown.
Okay, 11 years, again, really with the focus on exercise and how human behavior impacts people's decisions to exercise. Mm-hmm. So let's talk a little bit about that. I mean, kind of one of the teasers I gave folks was New Year's resolutions. Of course, right. Everyone says, I really should be, people know you should be getting physical exercise. The execution of it doesn't always happen a little bit. So tell us a little bit about what you look at specifically in the realm of human behavior.
Yeah, in terms of people who kind of have difficulty, starting a new habit, and then they kind of fall off the rails, one of the things that we focus on is exercise is a really complex behavior, and it's actually difficult to change. There's several decision points: where to exercise, how to exercise, when to exercise, with whom to exercise, and so it's not surprising to me that when people, for example, who have never exercised before are trying to adopt a new habit, or some people who have kind of fallen off the wagon, so to speak, and then they try it again, that they're not successful. Another thing to consider is that exercise should be enjoyable, and that for people in those types of situations who are just trying to adopt this new habit, exercising initially might not be pleasant. And so we want to try to do things to make exercise more enjoyable. Mm-hmm. And so, one of the first things that we would try to focus on is finding an activity that you find that's enjoyable. And so, for example, going to the gym might not be everybody's favorite activity or everybody's favorite setting to exercise. We also want to try to boost the enjoyment of the activity that they're performing. And so there's several different ways that we try to do that, whether it be listening to music or listening to a podcast when you're exercising. We also, particularly when you're first trying to start changing behavior, you want to reward yourself for at least achieving those initial goals. And so that kind of is helpful in the short term. It's not always helpful in the long term, but at least in terms of getting started. And one of the things that we try to do to sustain behavior change is we want to go from an external motivation to a more internal motivation, so that they're exercising for the exercise itself. It's enjoyable to them. They're not exercising because their doctor told them to, or they're not exercising because they want to appear more fit or attractive to somebody else. They're doing it for themselves. And
so how important is that you talk about people who might just be trying out exercising after a hiatus, or even for the first time, but having habits, does the regularity become ingrained, if you will, as you talk about it being a behavior? Yeah. How important is that to say, they always say stick to a regular schedule, but is there a science behind that?
Yeah, so one of the things that we're actually focusing on right now is how can we leverage the time at which you exercise to help with forming an exercise habit. And so we've conducted a couple studies recently that we've published, and one we did in the context of a physical activity intervention in which individuals with severe obesity were trying to adopt a physical activity habit. And when we did a secondary analysis, we looked at individuals who complied with our instruction to exercise in the morning. Okay. And those who better complied with that actually had higher physical activity levels. And in another study, we looked at people who were already maintaining somewhat of a regular exercise routine. And then we looked at that same question, and we found a slightly different pattern of results, is that it didn't really matter the specific time that they did it, they just had to do it consistently at their chosen time. And so what that suggests to me and my colleagues who are conducting this research is that when you're first trying to change a physical activity habit, exercising consistently in the morning might actually help with that. For individuals who already have somewhat of an exercise routine, time of day isn't so much the issue, it's actually exercising consistently at that time of day.
And you talk about consistently, you see the studies that say, have a certain level of movement every day. But when you're talking with patients or, who you're studying, is every day the goal? Could it be every other day, but is it like you should be out and moving and doing something on a daily basis? Yeah,
that's what the new physical activity guidelines really emphasize, is that all movement is good. When we think in the context of treatment, what constitutes a regular physical activity routine, that's usually coincide with some guideline. And so, for example, the CDC in the United States Department of Health and Human Services that says every adult should accumulate at least 150 minutes of moderate intensity aerobic physical activity per week, and that they should also do strength training 2 days per week. However, in my programs and in my interventions, I tell people to do it every day, particularly when they're trying to at least first start exercising. And I actually try to get them to think about exercise similar to brushing your teeth. It's something that's essential for your health and something that you should do each day. And I think when you're really, it doesn't mean that you have to go to the gym and do it for 30 minutes each day, but just do something every day so that it becomes part of your routine. And if you can do it consistently, so much the better.
And so you alluded to it before, just how important it is to find an activity that you enjoy. A lot of times there was that no pain, no gain type of mantra, but what you found and what research has found is that, again, doing that activity that is enjoyable is really tantamount to the success of keeping a routine going.
Yes, yeah. And so in terms of strategies to make it more enjoyable, one of the things that we're looking at, one of our faculty members, Jason Lillis, and I are looking at is, can you get somebody's motivation for exercise to coincide with their own values? And is that a way that it makes exercise and wanting to exercise, again, like I said earlier, that you do it for the exercise itself? So it becomes more about you're exercising because you value health, or because you value having enough energy to spend with your kids and play outside without becoming exhausted.
And so what can we expect moving forward? Coming to the Brown Alpert Medical School, saying that you, again, really wanted to get that research angle. What do you have on tap ahead for 2020?
Well, the great thing about Brown is that we have an excellent group of exercise researchers, and so we're all kind of doing different things, but I think that we're all kind of pushing the field forward in different ways. And so I'm really excited and honored to work with some of the faculty members we have at the Weight Control and Diabetes Research Center. For example, I've been working with Graham Thomas to look at ways how we can leverage technology so that we can help people make physical activity changes in the moment when they need it the most. So for example, if they've been sitting for too long, can we use the accelerometer within the smartphone to prompt them to actually get up and start moving? Also, in terms of leveraging timing as a strategy to increase exercise, my postdoctoral fellow, Leah Schumacher, and I are really working on that. And so we're trying to take it from the observational, the studies I taught you about, to see whether we can take it into the free living setting, and can we actually get people to adhere to a particular prescription, and also look at factors that influence whether or not they can actually adhere to that prescription. So for example, if we're trying to get somebody to exercise in the morning, we might want to know whether that person is more of a morning person or more of an evening person. So that might actually influence. And then we also want to look at whether the timing of exercise has effects on other weight-related behaviors like timing of eating, as well as sleep. And there are other researchers outside of our department that are also doing very interesting things. Also, Jess Unick in our department is looking at how exercise influences appetite, also how exercise can be used as a stress management mechanism. Anna Bronte's in the Brown system, which I think is a really important area, is to look at how exercise can be used as a treatment for different diseases. Like I'm interested in how exercise can be used as a treatment for migraine. She's looking at how exercise can be used as a treatment for drug dependence. And then we have researchers focus on how to make exercise more enjoyable, like Dave Williams, and then also how can we broaden the audience that receive these exercise interventions, and how can we make them cheaper and more disseminable And that's Dr. Bess Marcus, who's been at the forefront of this type of research for decades. So we have some of the top researchers in exercise at Brown.
Okay, well, I appreciate your coming in, telling folks a little bit more about the research, and again, that really standpoint of something enjoyable. Find something that you like and stick to it.
Right.
But the science coming out of the Brown Alpert Medical School is very much led by Dr. Dale Bond. So, Doctor, thank you for coming in, talking with us a little bit about maybe how to keep those resolutions or kickstart them again, because there's no time like the present to have a good exercise routine. So, Dr. Bond, thank you so much for your time.
Thank you very much for having me.
And thank you for watching us on GoLocal Live here in downtown Providence. Of course, we'll have more news, sports, lifestyle, and politics here in the studio. But that wraps us up for Wednesday. Be sure to see us when we tune back in tomorrow for more GoLocal Live. I'm GoLocal News Editor Kate Nagel.